we have here with us a special guest today. She's rank 1 in Gynaec Oncology, and it's an absolute delight to have her with us here. So,
Thank you.
welcome, Chandrima. So glad to have you here.
Thank you so much.
So, Chandrima has been one of our most active students on the Surgtest Gynaec Oncology platform. So, she's been attending all the classes regularly. She's been inquisitive on the group. She's been interacting with us on a very regular basis. And the entire team, we are a very small startup run by young surgeons. And it gives us a lot of joy when we see another young surgeon, a young obstetrician gynecologist do extremely well. That too in a very, very competitive field. There are hardly few seats in Gynaec Oncology throughout the country. The competition is intense, and it's an absolute delight to see people working so hard to pursue their dreams. Thank you so much, Chandrima, for being here with us today.
Thank you. Pleasure to be here. Thank you.
So a little more about yourself. Where did you do your MBBS and OBGYN training?
I did my MBBS from RG Kaur Medical College in Kolkata. Then I did my DGO from Kolkata Medical College and in 2013, and DNB from Tata Main Hospital in Jamshedpur in 2016. And after that, I had shifted to Gynaec Oncology. I did a fellowship in Gynaec Onco from GCRI Ahmedabad, and I've been working as a senior resident in Chittaranjan National Cancer Institute, Kolkata. I've been working in Gynaec Onco for last 4 years. I've been really passionate about this subject, and it's just I feel like all my hard work has been rewarded.
Great. So you are not a fresher. So you have been into this field for quite some time.
Yes.
So a few more questions.
Yeah.
Why Gynaec Oncology? What pulled you towards this field?
It's like the AIIMS interview questions. Actually, it's not what the I didn't choose the subject. It was like the subject which chose me. And initially, it was the vast range of radical surgeries that really attracted me to the subject. And these are the kind of surgeries that we don't see in our general obs and gynae. So it was initially the nature of the surgeries that attracted me. Then it was once I started working in Gynaec Oncology, it was it's more than just surgery. You learn management, how to manage a patient, how to diagnose, correctly stage a patient, what investigations you have to order, and which patient to operate, more importantly, which patient not to operate, and which patient should get chemotherapy, which patient to get radiotherapy, and how to individualize management. So it was all very challenging, and it has been a beautiful journey, very stressful, but beautiful. So I just loved Gynaec Oncology. In fact, I started right from undergraduate days when I was reading pathology or pharmacology, and when the chapters on tumors and cancers came up, I just somehow loved it. And
I can understand totally, because I'm in pediatric surgery, and every single time the thing which sounds most attractive to me is pediatric oncology.
Yes.
And you always feel that your efforts can make a lot of difference in the lives of these people. If you're good, if your subject is good, if your hands are good, your diligence and the effort you put has a direct impact on the lives of the families of the patients and the patients themselves. And I think that's an amazing.
Yes, that's very rewarding. And when we used to attend these follow-up clinics, and there were cancer patients returning to us, at the 9th or 10th year of follow-up, and they're cancer-free. So it's very rewarding. You feel like you can do something. If you work hard enough, you can make a difference in these women's lives. And then another thing about Gynaec Oncology is that there is a preventive oncology aspect to it as well. So you can do screening and treatment, as well as early detection and surgery. If you detect it in the early stages, you can treat it by surgery. So it's a vast range. So that's what really attracted me.
Satisfying. So you are working as an SR for 4 years.
Yes.
After your Gynaec Onco training fellowship, and I want to know one thing. Why did you want an MCH? What made you? Because you are as good as a consultant. In fact, you know a lot about Gynaec Oncology already. You would have operated a lot of cases. Why did you want that degree MCH?
See, I wanted to be part of a structured training, which you can get in an MCH course. And yes, and in today's time, an MCH degree is important. You know, if you're planning ahead, if you're planning to go ahead in your career, so it is important. It's not indispensable. Like, it's not like you have to get it, but it's good if you have it. So there are many people, many students who are preparing for MCH, and I just want to tell them that it's you already are specialists in your chosen field. So it's not that it's yes, it's necessary, but don't get disheartened. I mean, it's a it's been a it's very struggling. These competitive exams are very difficult, and
Absolutely. To be honest, I run search tests, and I know how
Yeah.
tough it is
Yeah.
because I interact with students across the spectrum.
Yeah.
And one thing, my partners call me crazy, but I always tell people that MCH is not the end of your life.
Exactly.
If you get MCH, it's great.
It's
If
great,
you don't
but
get, it's okay. You can still
Yeah.
spend more time with your family. There are days when I wish I could allocate more time for leisure, for family, and all. And
Mhm.
definitely, MCH definitely does take a toll on it.
Yeah, it's like an imaginary rat race, like you kind of invite this stress upon yourself. It, I mean, it is this. Yes, it is important that you have it, but it's not the end of everything. If you don't
I know.
get it. So
You
that's
know,
what I'm trying to like. I would want to stress on the
many times,
students.
work-life balance often becomes a myth.
Exactly, it's very stressful.
You really can't achieve work-life balance
Yeah,
if you wish to get ahead in this profession. I
Yeah.
know it's sad, it's disheartening,
Yeah.
but it's kind
It's
of
not
true
the
at
end
many
of the
levels.
line. Yeah.
Yes,
So
yes. Tell us more about your preparation. How did you
Okay.
start your preparation, and
Uh,
how did Surgtest play a role in your preparation?
Yes. So actually, I started studying while doing my SRship. I was already working in a clinical department. So I was already studying while I was working, because you have to update yourself constantly. So I started reading Berek Hacker. That is the basic in if you want to even start working as an SR anywhere, you have to read Berek Hacker. That is the basic book. And I became a part of the Surgtest family last year, and I had appeared for NEET last year as well, but I couldn't get through. So then I had downloaded the Surgtest app, and so it was really helpful because I did not have a MCQ question bank, so which is very essential for your preparation. So that app really helped me. The question banks are very good, very updated, so it helped me get on the track. And along with that, I read Berek Hacker thoroughly, especially the organ specific chapters: cervix, pre-invasive lesions, uterus, the endometrial cancer, uterine sarcoma, ovarian cancer, and vulva and vaginal cancer. All of them have to be read thoroughly and revised thoroughly from Berek and Hacker. In addition to that, I read Desaya. I read chemotherapy and radiotherapy from Desaya's textbook, and some of the tables from Devita. I didn't read Devita thoroughly, but the chapter, because AIIMS, asks a lot of questions on screening and preventive oncology. So that part I read from Devita. And I combined it with the question bank on Surgtest app, and I, along with that, the videos, the video classes of Dr. Alka and Dr. Vamsi were very helpful. So they were very focused
So tell us more in
on track.
detail about the video lectures. What specific lectures were extremely useful? Did the questions in the exam were you
Yes.
able to answer questions out of the video?
Yes,
So tell
yes.
us more about the video lectures.
So Dr. Alka's video classes were very good. That was the first class, I think. Dr. Alka had taken the first class, and it was an ovarian cancer, and she had taken a very detailed class, and it was good. It was she had these at the end of her class. It was a marathon class, and a big thank you to her, and organizing such a big class, and a big thank you to Surgtest, because you have to organize. It's a big task, setting up these classes and taking these classes for 7-8 hours at a stretch. And at the end, she took these MCQs at the end of every section that she finished, she took these MCQs, which were very helpful. And then Dr. Vamsi's class was also very good because he focused on cervical cancer, and that is a very important chapter in any entrance exam, especially AIIMS, which does a lot of screening work and preventive oncology, especially on cervical cancer. So Dr. Vamsi's class was very helpful, especially for AIIMS. And he hit that pre-invasive lesion class, that the section that he had taken on, I last minute revision I had done from his slides. So they were really helpful.
I'm sure both Dr. Alka and Dr. Vamsi are going to be delighted when they see this, because one thing I can tell you is that these guys are absolute gold. I mean, see, the money we pay them is a pittance compared to the hard work they put. They exude passion. When they because I can be a very to be put it, I can be a really bad guy at times. I'm critical, sir. No, sir, like this, sir. I'm like this. And you know what? These people, they don't give a damn about that. They just want to concentrate on the subject. They are extremely focused, and they are teaching absolutely just not because it's a source of revenue for them or anything. They just do it because they love it. And that is the feeling I get every time I talk to them. Whenever I talk to them, they talk to me about some case, something very interesting going on in their hospitals, and I think that's a kind of passion and zeal for the subject that I wish to see in everyone. It feels so happy to see people passionate about things. I'm sure you would agree.
I know. I mean, you can't go ahead if you don't have that passion to make a difference in your patient's life. So really a big thank you to them. And in addition, I would like to say that for the students who are preparing for AIIMS especially, please read FIGO updates thoroughly. Like I did get a few calls from the juniors who are working in the Surgtest app, and I would like to please stress, because many questions, they come from the FIGO updates. Like they pick up the sentences from the FIGO updates. So please read FIGO updates thoroughly. And also clinical trials have to be read in details, especially if you are preparing for AIIMS. I don't think in NEET they ask a lot of questions on clinical trials, but just read BEREC thoroughly. Read the trials that are mentioned at the end of each chapter and Google them and read them in details. And because they ask you very pinpointed questions on those clinical trials. So please read the clinical trials thoroughly, and FOGSI GCPR guidelines for the preventive oncology part.
I think that's a very useful piece of information. Yeah. One more question. I mean, I'm not going to prolong the interview. I know you are busy. You're waiting to get back. What was your schedule? How many hours per day do you prepare?
Okay, now honestly, I'm telling you, it was very difficult with a small baby, because I had to manage my kid and my work. I used to go to my work at 9 and come back at 6, and then manage my family. So it was very tough for me, but try to squeeze in 2 to 3 hours. I used to study at night, like after 11 o'clock I started studying, and early in the morning. So just see, right now you already have a set pattern of your own, so follow that. If you're a morning person, get up early in the morning and try to squeeze in 2 to 3 hours. Start with the basics, and if you study 2 to 3 hours daily, a month before your 2 to 3 months before your exams, I think you can finish the syllabus. And do not read anything new before 10 days for the exam. I never read anything new. I just did the revision. You have to revise at least 3 to 4 times. So I think NEET would be in August or September. So I think it's
God only knows when that's going to happen.
So by July, you should finish the first round of Gynaec Onco and then start revision. So try to read 2 to 3 hours. At least I couldn't actually study more than that because of my work schedule. But and the last 10 days, it was just revision.
There is one more thing I want to ask you. There are a lot of freshers and there are a lot of senior people. Did your training in Gynaec Oncology and the fact that you were working in a Gynaec Onco unit as an SR, did that help you in your exams?
Yeah, it did. It did because it helped in answering the clinical questions, because some of the questions you don't get in books. So it does help, having a fellowship and working as an SR also, because it's in a government setup. There's so many caseloads. It really helped managing learning the management protocol. It just comes to you as a second nature. So it did help me, my background. And also in NEET is actually purely 100, 100%, 100 questions are there, and 40 marks are there for your general obs and gynae, 30 is for your reproductive endocrinology, and 30 is for gynae oncology. But the difference in the AIIMS exams is it's 100 marks, it is completely gynae oncology. So 80 marks is theory, and if you qualify for that, there's 20 marks of viva. And this time actually viva pattern was a little different, because they had asked it in an OSCE pattern, like they had slides and CT plates and specimens. So all that helped. So the questions are very objective, and they really uh, my training in gynae onco helped me in clearing the viva part as well.
So you can say that there was not much bias in the exam. The fact that it was philosophy, I think that's a way to go also.
Yeah,
especially in an interview pattern, it should be OSCE based.
Yeah, it was purely OSCE based.
Just viva based questions.
Yeah. So this time it was different, and it was a very long viva, and they had asked very, very objective questions, like they give you an ultrasound picture and they will ask you what is the diagnosis, how would you manage, then they will give you a picture of a cut section of a specimen, so what is this and what is the most probable diagnosis, how they ask in your MD and DNB final exams, almost like that, but onco based. So yeah, so that helped.
So one final advice to your juniors, what would that be?
Okay. So I would like to tell them that please have faith in yourself, and do not listen to any detractors, any negative comments, and do not be disheartened by failures. It's not a failure. It's every exam is a learning step. So do not get disheartened, and just keep up with your hard work. Revise as much as you can. Start preparing early. I think there are many people who are, giving their MD final exams and they are, preparing for MCH. I think that's very, very good. And it was not like that during our time. And I like that kind of focus. And it's very good. Be focused. Do not lose faith in yourself. And when you're studying 2 hours, just concentrate. And keep the last 10 days before your exams for revision. That's all. I mean, you already know it. It's all in your head. And please try to get a good night's sleep before your exam. That's the most important thing. Because, it's all in your head. Whatever you have revised, it's ultimately how you give the exam on the day of the exam. That is what matters. So you might have read everything, crammed up everything the night before the exam. But if your brain is tired, you will not be able to answer anything in your exam. So please get a good night's sleep before your exam. That's my final advice.
I think this has been an extremely illuminating session. And,
thank you.
We have been very forthright with each other. Yeah. And one thing I'm very sure of is that 10 years down the line, Chandrima is going to be somewhere right over there on the top.
Thank you so much.
A leading gynaec oncologist who's going to make a very meaningful impact on the lives of millions of women. Because gynaec oncology, personally, I'm a big fan of gynaec oncology, because a lot of my surgical oncology friends and students are going to hate me for saying this, but I feel that gynaec oncology is more than just surgery. The focus on screening, the fact that women are some of the most vulnerable populations of the same. When I was a general surgery resident, I had a very diligent senior, and he used to tell me that whenever a woman comes to you for a breast tumor or any other complaint, just make sure you examine her cervix. You will pick up cervical cancer somehow. And I think that was one of the most beautiful advice I ever received, because he said that you have a duty to the women that come to you. Because in India, women tend to underplay their problems.
I know.
They don't tell. They feel that they are a burden on their family.
Exactly.
Men,
And the social problems, and these women, they never reach out to us for treatment. It's only like they're accompanied by family members, and at the last stage of cancer they'll come, and it's too late to do anything. So
men, when they have a small problem, they come right away. The entire family concentrates.
Yes.
Nobody gives a damn about women in the family.
So the women are very vulnerable in our society, and they just have this. They delay their reaching out to care, which is such a basic thing in any other country. But India, being a
patriarchal society,
it's just people don't want to reach out. The women, they just, okay, first I'll take care of my kid, I'll take care of my family, then I will go and get myself treated. But by that time it's so late. So I just hope, I'm also very much interested in the preventive onco aspect. So I have done a lot of work on screening, cervical cancer screening and all, and I really hope I can continue that.
Oh, absolutely. Absolutely. Because one of the saddest stories I've heard in my life was a woman with a pretty aggressive form of cervical cancer. I'm not an expert to comment on what was that exactly. She told me that she had come 3 months late because it was her son's board exams. And
this is a daily story in our OPD.
It was such a pathetic situation I heard.
Very sad.
And I hope you go a long way in smashing patriarchy. Okay. Thank you so much, Chandrima, for hearing.
Thank you so much, Dr. Vinayak.
Here with us today. It was a wonderful conversation.
Thank you so much.
I'm so glad it was not just about MCQs and video lectures.
That you will know better. I just and all the best to all the candidates.
Thank you so much, Chandrima.